I'd like to take a few minutes and talk about something that has been showing up in the medical literature called COVID toe. This is how they're referring to it, and what it really is talking about is a manifestation on the skin, mostly on the toes and sometimes on the fingers, of generally children or young adults who have no other symptoms of coronavirus. These young patients, who are usually children or young adults, are showing up with blisters or red spots on their toes or even their fingers. And sometimes they're itchy, sometimes they're not itchy. And right now, because not enough have been documented or biopsied, it's unsure exactly what the cause is of these lesions. It is thought that as the virus infects the body, one of the things that it does is it disrupts the lining in the small vessels. And when it does that, it throws off these micro clots that are very, very small. And as they move into the fingers and toes, where the blood vessels are very, very small, they can cause clotting in those little vessels that can give you this appearance of these red marks, or a vasculitis is what it's called, in the ends of the toes or the fingers. And as your arteries go from your main aorta in your body and goes down to your legs, every branch gets thinner and thinner and smaller till you get out to the tips of the fingers and toes. And when that happens, these very, very small clots can get caught. When this happens, the skin can look like you've got frostbite, or what they call chilblains. It can be blisters, it can be little red splotchy marks, and sometimes they itch and sometimes they don't. Now, I know that I read the American Academy of Dermatology currently has an ongoing study along with some societies, some medical societies in Spain and Italy. There really is nothing to do for it when it occurs. However, if it is something that a doctor sees in their office on an otherwise asymptomatic young adult, that would be a reason for that patient to go get tested to see if they are positive for COVID-19. It's just another way that the virus shows itself, just like chickenpox or measles, which are both viruses, will have a way that they show up on the skin. You may be asking, why is this even important to know? And the reason is that there's still so much about this virus that we are learning as we go and that we don't know. For example, they are now finding incidents of, again, young people in the younger demographic, 20s, 30s, 40s, who are dying from blood clots in their brain causing strokes. And this is really unusual in that age group, and many of these people are testing positive for COVID-19. We also had the incident of a beloved Broadway actor who lost his leg because of blood clots, and he tested positive for COVID-19. So knowing some of the signs and knowing some of the symptoms that may not be typical, and especially in our younger age group, it's important to know so we can stay on top of this and hopefully not lose more people than we already are. So thank you for watching this short PSA, I guess we could call it. And if you have any questions that I can maybe answer or defer to somebody who does know, please feel free to write them in the comments and I will answer as many as I can. So everybody stay safe and be well. And the hat is a shout out for my family in Southern California, hoping that we're going to have a baseball season this year.